Choosing a Medicare Advantage plan can be a bit confusing and overwhelming. In today's video, we're going to show you how to choose the best Medicare Advantage plan for your situation. One thing you want to take note is that you don't want to choose a plan based on your best friend, your neighbor, or the most popular plan out there. You want to really narrow down your search that is going to be tailored to your particular needs. And that's how we're going to help you navigate how to pick the best Medicare Advantage plan in today's video. So let's go ahead and get started. The first and most important thing that you want to look at is doctor networks. So you have HMO plans and you also have PPO Medicare Advantage plans. You want to make sure that your doctor is a network. So how do you choose between a HMO and a PPO? First, you need to understand the difference between the two. With an HMO plan, you're going to need a referral to see a specialist. However, with an HMO plan, you get more benefits such as more dental, vision, and hearing. Also, with an HMO plan, you must stay within network. If you see providers outside of that network, you have to pay the full price for those providers. So it's very important to make sure that your doctors is in the HMO network. Now let's talk about a PPO. With a PPO plan, you can see providers outside of the network. However, it's very important to keep in mind that you will pay higher copays to see those providers. Now, I want you to keep in mind, just because you have a PPO plan doesn't mean that your doctor or all doctors will take your insurance. They still have to agree to taking that PPO plan as payment. With a PPO plan, you do not need a referral to see a specialist, so that is actually a plus. Now, remember when I said with an HMO, you get more benefits such as dental, vision, and hearing. With a PPO, you tend to get less benefits such as less dental, vision, and hearing, and your copays tend to be a bit higher than an HMO plan. This is what I tell my clients. If all of your doctors take the HMO, it's best, in my opinion, to start with an HMO. Why start with a PPO and pay higher copays? Just doesn't make any sense. Save money every way that you can, in my opinion. Alrighty, so we talked about the HMO, we talked about the PPO, we talked about the provider networks. However, you can use your HMO or PPO in an emergency situation. So say you're out of town, you're visiting family, and something happens and it is an emergency, then you can get coverage for that emergency. So keep in mind that you can, in fact, use this plan for emergency situations. Now let's talk about your medication list. It's very important that you pick a plan that will help pay for your medications the most, okay? Just because you're on a Medicare Advantage plan and it has Part D drug coverage does not mean that it's going to pay for all of your medications. Different Medicare Advantage plans have different drug formularies, meaning that not every medication under the sun is covered. They're covered differently depending on the medication that you're on and the plan that you choose. So it's definitely very important to look at your medications and make sure that your medications are covered the most with the plan that you decide to choose. Do not forget your insulin medications. Some people tend to forget that. Don't forget the medications that's stored in the refrigerator and such. Make sure you get all of your medications and you look at each one to see what are your copays according to that particular plan. Let's talk about overall benefits. A lot of people forget about this category and they make this mistake. Do not make this costly mistake, okay? So what is important to you, such as dental, vision, hearing, transportation, is anything particular that is very important that you need to have within your plan. Just because your plan offers dental, vision, and hearing doesn't mean it offers the benefits that is important to you. So what does that mean? For an example, dental benefits. Do you need dentures? Do you need an implant? Those things you want to ask yourself when you're choosing a Medicare Advantage plan. Some plans will cover dentures. It all depends. Just because you have a dental benefit doesn't mean it covers everything within the dental or cavity. So it's very important to ask yourself what is important, and does this plan offer this benefit, such as transportation, over-the-counter benefits, and such. It's very important not to forget this category, which is the overall benefits of your plan. I have clients that will come back to me and ask me, does this cover dentures? And hopefully it does. And if it doesn't, it may be an issue because they did not mention that dentures was important to them in our initial consultation. So don't forget that piece, the overall benefits of the plan. The last thing you definitely want to consider is, do you have anything special going on for your particular situation? For an example, home health, dialysis care, oxygen, are you on insulin? All of these things are very important. You want to consider these situations and make sure that your plan is going to cover your particular need. Thank you so much for watching this video. If you need any assistance, give our office a call. We'd be more than happy to assist you. We help our clients with Medicare, marketplace health insurance, plan enhancers, dental, vision, and hearing, and such. Thank you so much for watching. If you enjoyed this video, please give it a thumbs up. Share this video with a friend and subscribe to the channel. Why not? Anyways, I'll see you on the next video. Thank you. Bye.